Hi, my name is Boatin Hodo Prosper. I'm a board-certified autism technician. If you have had the chance to live with a child with autism, even for a single day, you would want to listen to what I'm about to say. Welcome to the other side. Before I go to today's topic, I would like to send my greetings to my supervisor, Mrs. Bahija Danlad Shibani. She is a BCBA, that's Board Certified Behavior Analyst based in New Jersey, USA. I would say she practically made me an autism therapist. She taught me almost everything I know at no cost. It's kind of rare to meet people like her. She has time for all my questions and she's ready to answer anytime I call. Thank you, madam. I really appreciate everything you do for me. I have high hopes that your sacrifices will never go unrewarded. Thank you, madam. You might want to follow her and subscribe to her YouTube page, ABA with Love. Trust me, you would learn much more. Now we go to today's topic, the causes of autism. It is the utmost wish of every parent who has a child with autism to know what actually causes autism. But as I sit here, I wouldn't be able to tell you a succinct cause of autism. However, there are known risk factors that may contribute to having an autistic child. Genes play a role, and so do environmental factors. Environmental factors in that exposure to certain chemicals during the first trimester of pregnancy could put you at risk of giving birth to an autistic child. Chemicals like sodium valproate, antidepressants, and organophosphate insecticides have been known to have contributed to having an autistic child. So you might want to be careful during your first trimester of pregnancy. In fact, you do not have to take any medication that has not been prescribed by your doctor. And you might want to stay away from chemicals that have strong scents. I have had interaction with a lot of parents who have children with autism. And conversations that I've had with them prove what I am saying. Lots of them talk about being exposed to certain chemicals when they were pregnant and certain medications that they took without the consent of their doctors. I wouldn't say those actually caused or made them give birth to autistic children. I'm not saying so, but it could have put them at risk some way, somehow. So you might want to be careful with these chemicals. No one knows what goes on in the womb. Then also you might also want to eat healthily. Healthy eating is essential. Research have proven that children that are born with weight less than 2 kg have about 5% chance of being autistic. Then also having siblings who are autistic could also mean that you are also at high risk of being autistic. In fact, you have about 2 to 8% chance of being autistic. That said, I have had interaction with over 500 parents who have children with autism. And out of this number, I have had an encounter with only one that has 2 children with autism. So, in as much as it is possible, it is a possibility that you could have 2 or more children with autism. I've only met one parent that has 2 children with autism. Then, formerly, we used to hold a belief that boys are much more prone to have autism than girls. In fact, we are having a ratio of 1:4 girl boy. But in my line of work and in my experience, I have always doubted this, and recent research have proven me right. Not that autism affects more boys than girls, but autism affects girls differently from boys. So a lot of girls on the spectrum they are misdiagnosed, I would say. And so they miss the necessary treatment that they require. So if you have the belief that autism affects more boys than girls, strike that. It's nothing of the sort. Children that are conceived within 18 months after previous pregnancy and delivery are also likely to have ASD. So you might want to space your childbearing rate to a minimum of about 24 months. That would be okay. So there are women who have the view that I want to cooking things up so that I will have the time to focus on my career. So they do not space their childbirth. Please, you might want to reconsider. Then also, we are talking about children born to parents who are over 50 years, most especially the man. If the father is over 50 years, the child has some, I would say the child is prone to being autistic. That said, already, you will be in your office and there comes a 27-year-old man with his wife who is less than 27 herself with a child with autism. So it's kind of dicey when it comes to what actually causes autism. So if you have anything to do to prevent this, please do. Living with children with autism is kind of a full-time job. I'll put it that way. I do close to 15 every day. So we are talking about some 120 plus every week, averagely. And so I know what I'm talking about. Even living with one child with autism is quite a task. So if you have any chance to prevent giving birth to an autistic child, please do as much as you can. It's worth it. Thank you. And please subscribe to my YouTube channel, C.A.R.D, and follow us on Facebook at Louisville Center for Autism and Related Disorders. We are at Nyanchra Niase in Kumasi. You can leave us a message and keep your comments coming. We will also need you to share our video so that we educate any parent who has a child with autism in our subsequent episodes. Thank you and goodbye.